Good afternoon, everyone. We are so excited to have so many of you joining us for this Partnering for Success webinar. I'm Matt Wire, a Policy Director here at Education Commission of the States, and I'm so pleased to welcome you today. Partnering for Success is designed to provide you with opportunities to connect with peers, researchers, and innovators who are providing solutions to some of today's most pressing education policy issues. It's always our goal in these webinars to leave you with insights, inspiration, and resources that help you more effectively address the challenges you face in your state. Today's webinar will focus on innovative examples of how states are using their portion of the Elementary and Secondary School Emergency Relief Fund, also known as ESSER. We have a dynamic lineup featuring prominent leaders from 3 states, California, Mississippi, and Missouri, who are lending their expertise on how they have created and implemented new and innovative programs using federal relief funds. Our moderator today is my colleague, Chris Duncombe, Senior Policy Analyst at Education Commission of the States. Before we get started, we'd like to thank our partners who help make events like this one possible, and the Chan Zuckerberg Initiative for supporting today's session. Thank you for your continued partnership and support. We look forward to hosting Partnering for Success webinars with you and state education leaders throughout the year. Before we start, I have 2 reminders for our audience. We encourage you to add your questions using the Q&A button at the bottom of the screen. Also, this session will be recorded and sent to all registered attendees. You can view other recorded Partnering for Success sessions using the link placed in our chat. Now let me hand it over to Chris Duncombe, who will get our conversation started.
Thank you, Matt, and it's a pleasure to be here today. I'm really excited as we examine some really interesting uses of the federal elementary secondary school emergency relief funds. This is an area that has had a lot of people's attention since the first CARES Act was approved in 2020. And now, more than 3 years later, much of the $190 billion that has been sent to states and school districts has been spent, not all of it. 2 of the 3 obligation deadlines have come and gone. And so that does give us a bit of an opportunity for some reflection and learning. As an organization, one of the things that we strive to do at ECS is to bring education leaders together to facilitate cross-state learning. And so with that goal in mind, we've gone through state ESSER spending plans, enacted bills to lift up some of the unique and visionary ways that we've seen states put these relief dollars to work. Today, we're joined by program leaders in 3 of these states where the relief funds have been used to support very different and important services. That includes telehealth and teletherapy in Mississippi, expanded learning opportunities for students in California, and teacher recruitment and retention in Missouri. I also want to note that in addition to these examples, we've also collected case studies from other states and a policy guide that lays out some strategies for state leaders to support innovative services going forward. And you can view that on our website, or I'm going to drop the link right in the chat so you have that available for you. Now I'd like to welcome our speakers who will be sharing the wonderful work that they've been overseeing in their states. Today with us, we have Dr. Saurabh Chandra. Dr. Chandra is the Chief Telehealth Officer for the Tele Center of Excellence at the University of Mississippi Medical Center. He completed medical school in India and has a PhD in life sciences and completed a postdoctoral fellowship at the Cincinnati Children's Hospital and Medical Center. And he's been a real champion for supporting telehealth services for students. We also have Michael Funk joining us. Mr. Funk has been the director of the Expanded Learning Division at the California Department of Education since 2012. And under his leadership, the division has developed and implemented strategic plans to advance expanded learning across California. Also joining us is Dr. Bobby Jo Lewis, who serves as the Coordinator of Educator Development in the Missouri Department of Elementary and Secondary Education. She's a dedicated advocate for education, overseeing critical initiatives such as the teacher recruitment and retention grants that she'll be speaking on, and working closely with districts to refine strategies and develop impactful programs. So welcome. I'll start my first question with Dr. Chandra. I was wondering, can you tell us about Mississippi's school-based telehealth and teletherapy program? It's a bit of an introduction, and particularly the role that you play at the University of Mississippi Medical Center.
Well, first of all, thank you, Chris, for inviting me to the panel. So I'm a critical care physician. I moved to Mississippi from New York, and I was drawn by my passion for telehealth right before the pandemic. I was wanting to demonstrate the value for telehealth in a more underserved rural area. And this was in February of 2019, not knowing that 2020, not knowing in a month's time, telehealth would become a buzzword, well known to everyone in the country. But when I moved here, my role is I'm the Chief Telehealth Officer for the only academic medical center in the State University of Mississippi Medical Center, and as well as the project director for a Center of Excellence grant that we received from federal agency HRSA, as well as the project director for the Mississippi Department of Education's grant for developing the school-based telehealth program in Mississippi. So the credit and the vision for the school-based telehealth program, I would give credit to Dr. Carrie Wright, who was the superintendent of Mississippi Department of Education, and she had a vision, and it was very simple. Healthy students leads to better outcomes, whether it is better outcomes related to education, graduation, or better outcomes related to their overall access to health and reduce absences from the school. So she had a simple vision, and we at the University of Mississippi Medical Center consider ourselves to be privileged to have the opportunity to execute the vision that she had, and this vision us to actually, in a very short amount of time, within a matter of 1 year, we were asked to set up this school-based telehealth program in the entire state of Mississippi, and there are 144 school districts. 100 opted in for this program, and this is currently implemented in 70 school districts, 406 schools, and providing access to healthcare to 180,000 students all over Mississippi. So it's a large program, and we provide urgent care services at school, as well as behavioral health services, which everyone knows there's a real need in the entire country, and we have seen it really gone up since the pandemic.
Great, thank you, Dr. Chandra. Can you talk through how students are able to access these services in the school remotely, and why it's important that they're able to access these services in a school setting as opposed to just having the students go to a doctor's office or a hospital?
Yeah, that's a great question. Now, when you think about states like Mississippi, predominantly rural population, but really spread out, we have a number of counties that offer access to primary care physicians, mental health providers. Then school becomes a very important setting for us to be able to deliver health care. And so what we had envisioned was that, the kids who are, when they are going to a clinic and they're at school and they're in need of, healthcare services, it may take them a couple of days before they can access those services. They may have to travel long distances. Their parents have to come and then pick them up, take them to a primary care physician's office, which may not be very close by. At some instances, they may be away by 20, 30, miles. So having care directly available at schools is a way to overcome the barriers to accessing health care. And as far as mental health, access to mental health, I'll tell you many times, and this is nationwide, it may take several weeks to several months be able to access support for behavioral health problems. And our turnaround time for providing care to them, students at schools, is 48 to 72 hours. So we are providing care directly. So it's very important for us to provide care at school, because it obviates the need for them to travel long distances and wait a long time, because many times you need care right then. So that's why it's very important for us to be able to provide the care at schools. And this is how the school, the slide that you are showing right now, this is how the school-based telehealth program works. These are implemented in schools which have a school nurse there at the school, and they identify a student with a need for be seen by either an urgent care specialist, provider, or a mental health provider. Then the nurse notifies the parents, gets a consent for having the consultation done, and then contacts the Center for Telehealth. Our provider, we have provided equipment to all these schools under this grant. A laptop computer is given to all schools. Also, we have Bluetooth enabled devices such as stethoscope and otoscopes, which allows our provider to listen to their heart and lung sounds, to look at their ears and throat remotely. So that equipment is provided by us. And then once we are notified, our providers get on the on the audio video and get on the laptop, and the nurse on the other end facilitates the visit, the examination. The nurse providers, our providers do their assessment, and if need, they can prescribe medications to the pharmacy. And happy to note that it is at no cost to this for the student or their family members.
Following up on cost, Dr. Chandra, the ESSER funds that are being used, this is to support both the one-time equipment costs that you just described, as well as some staffing costs?
Absolutely. So this is at putting the technology there, supporting the administrative staff to administer the grant, as well as for provider services. We had to staff our Center for Telehealth with the right provider. So all of this has been covered by the grant. And as you're showing in this slide here, we are seeing since the first program, the first implementation at 4 schools started in August 2022, and now we are in the fall of 23, and we are seeing a nice uptick in the utilization for our program for both the urgent care and the behavioral health services.
Great. Thank you, Dr. Chandra, for sharing this great information and your work to expand healthcare to students, particularly in rural areas of the state that may not have access to it, and improving school attendance. There's a lot of benefits to this program that you highlighted, and it's been wonderful to hear more. And we'll dig more in on our Q&A on your program. I'm going to shift our focus now, since we have 3 wonderful speakers here, to Michael Funk. Mr. Funk, I'm wondering if you can start us off similarly as Dr. Chandra did, by explaining to us about the expanded learning opportunities grants in California and what districts have been using this substantial investment for.
Of course, Chris, and thanks also for the invitation to be part of this panel and talk about the work in California. And Dr. Chandra, thank you so much for your work with telehealth. My family's benefited from telehealth, and it's just a very powerful resource. So thank you for your work. Expanded learning in California means different things. And it means different things across the country, but there is a definition of expanded learning in California Education Code. And in short, it refers to out of school time, before school programs, after school programs, and summer or intersession programs. The term expanded is intentional because it's not simply an approach to extend learning minutes or extend the day, but it's working specifically to expand learning in a way that is more active, project-based, more student-driven, less defined by the curriculum and the bell structure, and more defined by the depth of relationship with the adults. And it has a rich history. I've been in the department for 12 years, but for 20 years before that, I was in the Bay Area. I was the founder and director of a community-based organization that worked with young people, families, and developed full service community schools, and have been advocating for public funding in California for expanded learning since the early 90s. So in March 2021, the state of California enacted Assembly Bill 86 and put $4.6 billion into the education system to be used by districts as we're thinking about reopening schools and bringing students back in California, specifically for supplemental instruction, support for social emotional well-being, that's whole child approach, and meals and snacks, etc. And I do have some additional information I can share that actually gets into more specifics. The 7 bullets on the left are exactly what the law allowed for districts to spend the money on. And each LEA, local educational agency, needed to develop a plan approved by their governing board. And they could extend instructional time. They could accelerate process to close learning gaps through expansion or enhancement of learning supports, such as tutoring, integrated student supports to address barriers to learning, community learning hubs, support for credit deficient students, additional academic services, training for staff. You get the picture. It was really flexible money. What do your students need? What do your adults need? And in this case, even though it was called the Expanded Learning Opportunities Grant, these funds could be spent during the school day, not just out of school time. So it was a combination of both. This funding has been studied by the Public Policy Institute of California. There's a link on the webinar on the slide deck that you'll get. But it does talk about that graph on the prior graph, talked about how the money has been spent across. It should also be noted that the Expanded Learning Opportunities Grant is actually funded by multiple federal sources, multiple ESSER sources, and the GEAR funds, and it's a combination of 5 or 6 sources of funding, and all of the different liquidation dates and things apply, including the recent federal extension. So districts are still using this money and spending it. It was one time back in 2022, and but it's still being used today. I know, Chris, you had some curiosity when we talked about the state funding.
Yeah, well, what's one of the really unique things that has jumped out to us when we were learning about the Extended Learning Opportunities Grant Program was the state at the same time was creating or was funding large investments in the Expanded Learning Opportunities Program. So you're providing an opportunity for sustaining these types of services after the federal funds expire. And we know that deadline is now approaching next year. So I was hoping that you could talk about some of the state investments in the Expanded Learning Opportunities Program. And I think you also have some slides and information on that.
Yeah, so let's look at that graph that was up on just a minute ago. The orange bar graph is the money we had for expanded learning in California. This is the out of school time funds prior to COVID. And California was unique in that it was $750 million in state funds and about $150 million in federal 21st century Title IV-B funds. These were grants to schools. It funded about 4,500 programs. And of course, this was exponentially more money than is out there in fact, all 49 states combined. So we were unique in the sense that we had this large infrastructure. Then the middle graph is the Expanded Learning Opportunities Grants, the one-time fund I just talked about. And then in the summer of 2021, the state announced it was establishing a new ongoing expanded learning opportunity program that is also in the Ed Code. And it started off being funded about 1.7 billion. It's now currently at 4 billion, projected to go to 5 billion. And what's unique about this is ongoing funding. Every year, an additional, right now, $4 billion will go out to the local educational agencies. It targets primarily TK through 6th grade. The money can be used for higher grades, but it is also an apportionment. Districts don't have to apply for it or compete for it. Every local educational agency receives an apportionment and then creates a plan on how to spend this money. The formula for the apportionment is based on what we call unduplicated students in California, which means a student who is either English learner in foster care or eligible for free reduced meals. So it targets those populations. And then finally, these are the dates. The ACES is after school education safety, the 21st, and ELOP. What's also unique is it's the intent of the state that these different funding sources at the school site level create one comprehensive program. So we're not making people keep their funding and kids separated by funding type. It's really trying to make a seamless experience for students and families and the adults in the program, funded by the different funding sources.
Great. Well, thank you, Michael, for sharing with us the significant investment from California. And I think we'll definitely have some time for our Q&A to dig into all of these examples. But what really jumped out to me was your use of blending different federal funds to expand seat time and tutoring services for students that has everyone's attention right now with the drop off in performance following COVID-19. And so this was a strategic way to use federal funds and then supplement and support them going forward with ongoing state investments. I will now transition to Dr. Bobby Jo Lewis. Similarly, I was hoping you could start by giving us a bit of an overview of the teacher recruitment retention grants that Missouri has implemented and the emphasis that you have put on for openings that have been most challenging to fill in the state.
Yes. Hello. It's such a pleasure to be here today and to be able to discuss all these things that the other states have been doing. It's a wonderful opportunity to hear and to learn. So thank you for allowing me to join today. Missouri found ourselves facing some significant challenges, and I think other states around the United States have had the same issue, and that is a significant number of teachers were no longer wanting to stay in the education field. In January of 2021, a quarter of teachers indicated that they wanted to leave the field or that they were thinking about leaving education. As of, I think between 2020 and 2021, we had 300,000 educators in the United States leave the profession. And so Missouri found ourselves trying to come up with ideas, and having this money allowed us to really be able to be innovative. And we were able to utilize, $50 million to develop a statewide recruitment and retention program that would allow us to have opportunities throughout the state to look for strategies that were special to their districts, and that would be able to allow them to do innovative new ideas, just different things that they've never been able to do before because maybe they didn't have the funding or the flexibility. And so this money really allowed us to provide them that opportunity. And we've had some great success. We've had a lot of districts that were able to really make progress. And we're really early in this. We've only had a full 2 years in the process, but we've had districts that were really able to come up with some strategies to help them recruit and retain. So we had districts that were given the opportunity to apply for retention grants, and those retention grants, of course, had to be innovative. They had to agree to provide DESE with data, and also agree to participate in an evaluation to help us gather that information to look for strategies that were successful and could be replicated in other districts. They also had the opportunity to apply for recruitment grants or grow your own grants, and that would allow the districts to come up with a plan and specific strategies to help grow their own teachers in their communities that would help them meet the unique needs that their community has, whether that is equity, whether that is a diverse teaching force, whatever their need may be. This money allowed them to come up with some strategies that were really specific for the needs of that community, and allowed us to really do some things that we've never been able to do in the history of our state in education. So it's been exciting to be part of this. And we are really learning some really valuable data from the districts, and they have been wonderful to provide that information. We've had a very high percentage of districts that have absolutely 100% replied with data, provided artifacts, they've done interviews, the whole thing. And so we have a lot of information that is available and more that's going to become available. Another portion of this was we were offering educator prep programs and community colleges the option to also apply for recruitment grants. And so we had a number of those universities and community colleges take advantage of that. So they were able to also come up with innovative strategies to help bring potential teachers into the field. And we've seen a lot of participation from the educator prep programs and from those community colleges. 100% of them in Missouri took advantage of these grants and applied for them. And they're also part of the evaluation process. And so they are submitted that information to us as well. And so it's just been a great opportunity for us to utilize these funds and really help districts come up with solutions that will work for them.
Thank you, Bobby Joe. You mentioned evaluation and getting data from school districts. I'm wondering if you could talk into some of the learnings that you've gotten from your monitoring process so far.
Yes, absolutely. So we have we've partnered with a third party to complete our evaluations for us, and it's a 4-phase process. We've completed the first 3, and the final report for that will be published in the next couple of weeks. I've seen some rough drafts of it, and I'm very excited about some of the information that will be coming out. And I've got a few tidbits that I have gotten permission to share with you guys. So I will be able to do that today. So talking about recruitment data from the local educational agencies, 61% of them have indicated in our data collection that the recruitment strategies were successful and they have seen an improvement in the recruitment efforts. So that's a 61% increase from 2021 when we started to 2023. So that is a very large increase, and we're really excited to be able to share some of those specific strategies that will actually be out in the official report that'll be coming out in a couple of weeks. But that is one of the things that we were able to kind of share with you. Also, the recruitment grant data from educator prep and community colleges, they had 62% of them that have indicated that there's been an improvement in recruitment efforts. So there's been an increase there as well. And we'll be able to share more of those strategies when the official report comes out. And of course, that will be, available on our website. But it's been, the support has been amazing. So switching to retention grants, we've had 63% of local education agencies also indicate that they have seen an improvement in retention efforts in their local districts. Their retention has increased for a variety of reasons, and some of the districts have just been so creative and so innovative in coming up with ideas. Many of them actually surveyed their staff and asked for, ideas. What would help you or make you interested in staying, and staying in the education field? What are things that we can do? We have this opportunity, let's take it, So we've had some great response back on that. And I think as we're able to really start sharing some of those specific strategies with districts, hopefully they'll be able to replicate some of those.
Great. Well, it seems like you're seeing some very concrete benefits in terms of the teacher pipeline in Missouri. You'd gone into a little bit more detail on the retention grants, and one of the things that was unique about that program is its how it was being allocated. Could you speak a bit to how Missouri was kind of intentional about focusing on some of the areas of the state with the hardest retention challenges?
Yes, absolutely. So we used a formula basically, and we looked at not only population of the district, but also things like free and reduced lunch rate and indicators like that that would help us identify districts that might be a little bit more having a little bit more of a challenge to recruit and retain those teachers. And so those were put into a formula that allowed us to then come up with an amount that each district was going to be able to get and request. They could request up to that full amount that was their allocation, or if they did not use all of it or need to use all of it, of course, they did not have to use the full amount. But we encouraged them to do that, and to request that full amount based on the allocation. And we tried to really take into account those indicators that would help us as a state identify the districts that needed the assistance the most.
Great. Well, thank you so much for sharing the wonderful work that you're doing in Missouri. I'm going to bring back Saurabh and Michael, if that's okay, if you guys are ready to join us. And we're going to dive into some of the questions. One question that has come up, and I think Dr. Chandra, you spoke to this a bit, has been around challenges around implementing new programs and services in such a short time span and how you overcame that short implementation window.
So, yes, Chris, I mean, there have been, several challenges, and I can enumerate a couple of them. First of all, when we were tasked to implement this program that was still, COVID was still there. If you remember, 2022, there were issues with supply and demand of computer chips. And so there was a kind of, we were nervous whether we would be able to meet the timeline of getting all the laptops, 700-800 laptops, purchase them and have them installed to meet the timeline. But thankfully, we approached several distributors and we were able to meet that timeline. But then, other challenges, of course, that what we found out, and it was interesting that we just heard from one of the speakers talk about, recruitment and retention for teachers, but recruitment and retention for nurses are also a big issue, and not only for school nurses, but pandemic we all saw shortage of providers, especially nurses, that impacted provision of healthcare across all healthcare settings throughout the country. So that was in itself a very big challenge, because the patient has to start with the nurse identifying the patient, the student is appropriate for this kind of consultation, and they are the primary drivers. And many of these school districts, they have multiple schools within one school district, but they may have only one nurse or two nurses for 5 or 6 different schools, and they are distributing their efforts between multiple schools. They are very, very busy. And I've talked to some of the nurses, unlike many urban areas where there are more resources, many of these school nurses go beyond their task of just providing healthcare services to take care of other things for the students. They're so invested in the students. And I can tell you that some of the nurses, they may be providing, feeding the students. They may be even utilizing the washer and dryer in the schools to wash clothes. Sometimes they go well beyond their duties and even buy medications for students who cannot afford that. And so they are busy, and for them to then have time to then go on, utilize the technology, then facilitate these visits, the question is, am I adding to their daily workflow burden of what they're already doing? So we have found that, some school districts have more nurses, nurse to school, the student ratio, and those places we have seen better utilization of our numbers. And it's not that the nurses don't recognize the value of the program, but if you have one nurse for 10 school districts, they just don't have the bandwidth to be able to perform these visits. So one way that we are thinking of moving forward is maybe we may have to extend the hours to allow some of these services outside the school hours in the homes of the kids as well. Because at the end of the day, the program, what we are targeting is the overall health of the student. We're trying to improve that, and it may be that we may have to extend those hours that those visits can be facilitated by the parents. So that was one big challenge, but we are working with the school nurses and making, trying to solve some of their issues, because one issue was it was taking too much time for them to go through the technical process before the provider is seeing the student. So we overcame that by actually reducing the dependence on technology and bringing people into the workflow, introducing. So we have coordinators where now housed in the center. Nurses can directly just call the coordinator, and we take care of everything, rather for them to remember their logins and passwords. So we have made it easier for the nurses to navigate through the technology. There are also a big challenge is that I'm actually not sure even today how many parents are actually aware of the program. Many of them become aware when we are talking to them and informing about when their children are sick, but we are not directly communicating with the parents. It's done through the school system. We provide our marketing material, but one of that is awareness of the program, and awareness of program leads to better utilization, and that has been a challenge that we are working with the school districts to inform the parents about our program and benefits of that. And they also, I would say, when we first implemented the program, there was this strong emphasis now is on integrated care models, where there is the coordination of care that is provided to the children. The coordination is provided by their primary care physicians, the pediatrician, and we didn't want the pediatricians and primary care physicians not to know what kind of visits that the students are having with the telehealth providers, and they had raised some concerns which we felt were valid. And so what we have done is we provide, if the parents give the consent, we are able to provide a summary of the visit. We are able to send it to the primary care physician and the pediatrician for the students, so that they are aware of the visit and can provide adequate follow-up.
Well, what I'm hearing, Dr. Chandra, is there's no shortage of challenges in getting a program going this quickly. But it does seem like you've taken some really important steps in hiring additional coordinators to help with some of that initial training for staff, particularly in schools that already have staffing shortages and are stretched too thin, and are going out and doing awareness building to help bring greater participation into the program. And I think those are some really important strategies that all states and districts can learn from. I've just received another question. Any tips or strategies for messaging good news updates, positive results to the public, and effective ways of a messaging on accountability of how you're using those funds. So this is a question about sharing positive news about the program, ways of building public awareness, and also holding the program accountable for using funds in effective ways. Maybe Michael or Bobby Joe, if you feel like you can jump in here.
I'd be happy to jump in. At the start of COVID, what do you do with expanded learning money for after school and summer when there's no school? A bit of a challenge. And so similar to just listening to Dr. Chandra talk, we're deeply concerned about whole child health and wellness. So we talk about expanded learning as a time, but the staff are dedicated to that whole child approach. And so in COVID, we actually provided flexibility for both the state and federal money for these community educators, which is what we call our expanded learning staff, to be the connection to families that districts had lost track of. So they're from the community. Typically, they know where the families are. The families will open a door, and they were doing all types of support, helping the family connect to health resources if necessary, or even the basics of bringing food to families who were, in food deserts at that time. But to the point of the good news, we were seeing, we gave that flexibility, and yet there were many educational leaders who didn't want to believe it. They didn't want to step out and take that kind of a risk. And so we started early during COVID doing fireside chats, video blogs, and bringing educational leaders onto a video interview to actually have them tell their story about what good things they're doing and how they're using the flexibility and the funding. And when this new ELO grant and the expanded learning program came out, it's the same thing. For some people, they took the ball and ran, and we try to find those stories and tell them through press releases and articles and write-ups, and getting different partners to highlight their stories. But again, we kept the fireside chats going to bring on local educational leaders and their community partners to tell their story. Well, this is how we're using this new funding. And it really did a lot to unlock people's imagination and take people, it's strange for the State Department to say this, but I spend a lot of time trying to get people not to think about compliance first, but first think about what the communities, children, and family need, and then work with us to find a way to do it. And we've done that. We've found a way to shift things around so people could really help people. So that's just a couple of things on my end.
So we started off trying to get all of our regional professional development centers on board first, kind of breaking the state down by regions and rolling the information out in those sections, bringing community partners in and having conversations and providing as much information on the initial application process as possible. We've done a lot of news releases. We've done a lot of I've hosted forums through Zoom to talk to districts that are having strategies that are really successful, to give them a chance to share that with other people in their regions. We've done a lot of presentations and conferences around the state. We've tried to look for ways to really spotlight success stories and share that information, and allow districts to have a chance to talk about some of the things they've done. We've done a lot of roundtables at conferences where people register and they come in and they come to this particular conference or this setting that's scheduled, and they're able to really talk about what works for their neighbors and what's not working. There are so many things that they have to focus on in education. There's just an opportunity to come together and talk and share, I think, was really beneficial. That was one of the things that they had replied back in the evaluation data, is that they appreciated the opportunity of being able to talk and discuss with other districts what strategies were successful and what weren't. And that has been very helpful, just continuing to make those connections. We built up a lot of very strong connections with our educator prep programs, and really working with them on how to, draw in, people that are interested in becoming teachers. Our Grow Your Own grant has really taken off. We had I think very successful Grow Your Own federally funded portion of that. But the money is coming to an end, and what are we going to do next? How are we going to continue this? And so we actually formed the Blue Ribbon Commission in Missouri, and they made some recommendations after many meetings and many hours spent on this. And they made the recommendation to the state that we need to actually have a state funded Grow Your Own. So this year we have unrolled a continuation of the federal one, but it's a brand new state funded Grow Your Own grant, and we were able to go through a competitive grant process and award 125 districts an additional Grow Your Own grant. And they had to be, again, they had to be innovative. They had to look for ways to increase the equity and increase the diversity in their teacher pool. And we've had districts that have really looked at programs starting in 8th grade, for example, all the way up, and growing their teachers and doing those programs like Future Teachers of America and Educators Rising and things like that. But I thought it was really important to also add in the portion of, we have community members, substitutes, paras, people that would make excellent teachers. And for whatever reason, they're not able to continue on that path. This grant was an opportunity to allow some of those individuals to get tuition reimbursement and to, help eliminate some of those roadblocks that are keeping them from becoming educators. And those relationships have developed from what we started with the federal grants with the first round. And so it's been really exciting to watch that roll out. And I think that really just comes a lot from being able to share with people and having conversations like this, whether it's through camera or on the phone or at a conference, and just sharing the information with as many people as we can to help change the narrative, and promote education as a profession.
Wonderful to hear stories of sustainability of some of these programs. We've heard today about some of the upfront costs and training and equipment that needs to be purchased. And it's great to hear that now that they're started and rolling and seeing positive outcomes, that they're able to move forward and continue after next year. We just received an additional question it's a little bit looking at challenges, but it's looking at where are the spaces or opportunities for innovation for each of your programs, or what future innovations do you see are needed in either expanding learning opportunities for students, increasing the teacher pipeline, recruiting, retaining teachers, or offering healthcare services, school-based healthcare services for students through telehealth or teletherapy?
I have a really great response to this. You talk about, or as a society, we talk about internships, and we talk about people that are able to do some program to learn mechanical skills and different things like that. We don't talk very often about doing internships for teachers and helping that be part of the pipeline to take them into the educational field. And so we have a number of districts that actually started a teacher internship. And so they are youth apprenticeship, it's sometimes called. They used their Grow Your Own funds to start programs where they have a class with one of their high school teachers where they earn dual credit. And that is through a relationship or connection that we've built with the local EPP. So they get high school credit, they get college dual credit, and then they actually get to work with students and classes in elementary or middle school, and actually come in and aid and be able to use those hours. They actually get paid for those hours, so it's like an internship or something to help meet those needs. A lot of times our high school students have to work to pay for expenses and pay for things. And so this allows them to be able to learn. They get to aid teachers. They get to, learn how to do lesson plans and see the interaction between students. They get to choose the area that they're excited about. So for example, if they wanted to be, a elementary art teacher, then that program would place them with an elementary art teacher and they would be able to shadow and work. And then they would also be able to do after school tutoring and be able to help as an aide, as a teacher's aide in summer school. And so they get all of these hours to shadow and to learn about what it is to be a teacher before they even go to college. So I think really starting to develop those and focusing on some of those youth apprenticeships and those internships to allow high school students to get contact and learn how to be a teacher and what that means is going to help our recruitment efforts and even our retention efforts as they then move on into the next phase. So then they go to college, they've already had sometimes as many as 12 college credits that they've earned if they've done this for several years. And then they are able to get scholarships through their Grow Your Own programs, and they're able to complete their education degree, go back to their home district, teach, and start that whole cycle again. And I've seen it work now in several districts, and it is an absolute joy to watch that and to talk to some of those teachers that have gone through that entire cycle and are now back in their home districts because of these programs.
Thank you for sharing that wonderful example, Bobby Joe. Michael or Saurabh, any other future innovations that you see?
Yeah, so, when you talk about innovations and telehealth, Chris, my problem is how much time you have allocated to me to answer that question. I can keep going and going on that, but
3 minutes.
So I'll tell you about an innovation that we are actually putting together. So when you talk about Mississippi, and I think that's true for our country as a whole, we have 13% of the population in our state that has active diabetes and diabetes-related complications. But 34% of our population is vulnerable or at risk of developing diabetes. So one of the things that we are working on as a pilot through support from this grant is we are training 50 to 100 school nurses to become lifestyle coaches. Now think about that. Once they have the knowledge about lifestyle coaching, and they have students, and they see students who may benefit from behavior change and lifestyle coaching to address problems for obesity and weight management, they can identify students, they can guide them, coach them on behavior modifications, some lifestyle changes, all with the idea that if we can reduce the incidence of new onset diabetes in our population, and that's going to have a very long-term impact if we can continue with this program, and that has a lot of downstream benefits. That's just one, and I'm stopping there.
You have time I'd like to build on that, Dr. Chandra. I think we all know that in our school, we're all aware that our children are really struggling with their mental health in public education, especially coming out of COVID. It's a crisis. And we are specifically working with state health agencies to explore a partnership between K-12 education, specifically expanded learning, and mental health resources. Most of these students, when we talk to them, they don't necessarily want clinical therapy. They want, like that lifestyle coach you're talking about, doctor. They want someone to be with them, to listen to them, someone that they know cares about them, someone that trusts them. There are many students that go through a school day not having a significant caring encounter with another adult. And of course, that exacerbates the need. And we believe that we could leverage Medi-Cal and some of our community educators who maybe work before and after school for 3 or 4 hours, could be trained as wellness coaches for students and move into the school day and be a presence all through before and after school and in the school day to support these kids. And so I think that sense of innovation of these two universes, by the way, when we get together for meetings, we don't understand each other. We're using all types of acronyms, and you have to get out a lexicon just to have a conversation, but it's worth the work to keep the student at the center of these conversations and figure out how to leverage the different resources and the intent. So expanded learning is not just a program, it's a space and time, and there are humans that are resources that could and should be brought into the school day and support our children.
Well, thank you all for sharing this wonderful work. And it's really kind of heartwarming to hear the dedication that you all have to bringing these services for students. And it's also uplifting to hear some stories of how these can be sustained going forward, with a lot of attention now on the federal funds winding down next year. So I want to thank Dr. Lewis, Mr. Funk, and Dr. Chandra for being here and sharing the wonderful work they're doing. We have more information about their programs with links to the direct programs that they are running if you want to learn more about them, or feel free to reach out to Education Commission of the States, and we're happy to connect you all. And thank you all for joining us. I'll give it back to Matt to wrap us up.
Thank you, Chris, so much for the great moderation, and to our speakers for their insights. Such a great privilege to feature your states and your great work. Thank you again to all of you in the audience for your engagement, questions, and time on the webinar. We're grateful you've joined us. And again, please remember, ECS is here to support you in your work. We hope that you're taking away at least one idea from today's session that might support you in what you're doing in your states. And if you do have any questions, Chris's contact information is listed here. Please reach out to him. And as I mentioned earlier, today's session will be recorded and shared as part of a post-event email. So again, thank you. Have a great afternoon and evening. We are adjourned.